Welcome, everybody. It's so excited to be here today. I'm Dr. May Badajo, and I have the honor of, interviewing Dr. Reddy, Pradeep Reddy. It will be like a back and forth conversation, but I'm just glad to be here with him. He's such a visionary. I had the honor of meeting him as a resident many years ago, and has kind of mentored me along the way. And when this vision for Rapha Haven Hospital or Rapha Haven Health City came into being or was just a thought, it was one who nurtured the idea. And we're just so excited to hear and really pick his mind. I feel like I'm picking a mind of greatness here. So, Dr. Reddy, we're ready for you. I'll let you say something hello, and then we'll jump right into questions if you're okay with that.
Absolutely. Hi, everyone. My name is Pradeep Reddy. I'm a pediatrician and a neonatologist. As Dr. Badajo told me, I was her teacher, and I'm continuing doing both general pediatrics as well as neonatology. I do love teaching, and it's my passion, and we jumped onto this new venture, which we'll get into later. Thank you.
Excellent, excellent. Thank you, Dr. Reddy. So we'll jump right in. We've done a lot of introductions of lately, just sharing the idea, sharing the vision of Rapha Haven Health City. And let me just start with an open question, and if it's okay, we'll go back and forth. What is Rapha Haven Health City? At least what do you envision it to be? And why is now the right time to launch such a vision like Rapha Haven Health City?
Sure. So I have been watching the developments throughout the world, not just in US, but in India and a few other places I've been. And technology has changed a lot. So the question
Mhm.
as to why now technology now allows us to do things that were not available in the past. Why Rafa Haven? Because there is a huge need in Africa. And right now, a lot of people, in fact, when I was talking to some of the people, they said my uncle went to England to get his hip replacement. My so and so relative went to India to get some other thing done. So there is a huge unmet market where people are needing the care, but it is not available out there anywhere in African continent at this point. So the goal that we are looking into is to create a world-class facility that is going to not only cater to the local area, but also to the continental area, including all the surrounding countries, and this will become the preeminent teaching as well as a tertiary care medical center that is also going to create the next generation of doctors and leaders.
Love it. And I think you answered very nicely because the next question I was going to ask was, what do you think the critical care or what critical gap in healthcare does Rapha Haven, feel that other projects do not do? And I think you went into that saying that, this is filling out, the spaces where you have people going abroad, going many places to get things that could be done. And with the advent of telemedicine, there is so much that we can do with that. So that's really great to hear. Just, following along with that question, for many physicians, and we were looking at the statistics the other day about the number of physicians, from the continent of Africa, from Nigeria in particular, in the US, in the UK, and in Canada, the numbers are just startling. They really are. The question I have to ask you is, why should, diaspora physicians, medical professionals see Rapha Haven as a platform to serve?
Sure. So the main reason for that is giving back to the community. This country of theirs gave them so much. They were able to succeed and move on, and it is time to give it back to their country that gave them so much. That is going to be my first answer. Second answer is, as I mentioned previously, the technology now allows where initially you physically had to go back to your country, stay there and do things. The telemedicine is a great platform using which you can provide care, you can provide a second opinion, and a lot of other things that can be done. So that is the next reason why people need to go back and do it in their country. The final reason is, like a lot of other things, healthcare is also evolving, and there is a big disparity between what we have in Africa to the cutting edge technology that's found in the Western countries. And like a lot of other things, that gap is getting narrower and narrower. And we feel it is high time that we develop something that people who have left the country can come back and give back to the community, also in a way that it is not going to cause too much interference in their own lives. So it is feasible. It is a must to give back to their country, in my opinion. And finally, we are going to create a platform that will seamlessly integrate everything from the patients to the physicians to the paramedical services, all of them, including teaching and getting that next generation of providers get there.
Excellent. Dr. Reddy, you hit a lot of points there. I love the give back part. I mean, that's, I think for when we look at Maslow's hierarchy of needs, the top is, self-actualization, but then giving back. And this gives us the opportunity to do that. So let's go a little granular with our question in here. So how does Rapha Haven intend to make it easy for diaspora providers to contribute, even just for a short stay? You talked about that knowledge transfer and things of that nature, but how being more practical with it, what's the vision? How can they, what's the plan so that they can do this even for a short period of time?
Sure. So it is twofold. One is through the telemedicine that they can commit an hour a day, half an hour a day, or a particular set time on a particular day that they can. Particularly if you are in a Western country, you start your day in the morning, and before you get to work or after your work is done, you can always set the time away to give a second opinion or a telemedicine. But more importantly, the next step that we are also doing is we will allow those physicians to go back to Nigeria, stay there in our facility. We will provide them the accommodation, the opportunity to stay there, develop things, the airfare, everything is going to be covered, and also a nominal pay to cover those stay period. So that's essentially what we are going to be providing.
It's amazing. Few more questions for you. I know it's a short interview, but I'm
Sure.
really just excited to be here and just learning here. So, in terms of knowledge transfer, this has always been a big deal. Again, many of us travel to the West to learn so much, but then we have local doctors and nurses, and there's just that gap in information, even though information seems to be everywhere. How do you see that knowledge transfer happening to local doctors, nurses, beyond the diaspora visit?
Beyond that, the plan is to develop a medical city. It is not a simple hospital. The medical city will involve every aspect of medical care. That will include the physicians, the nursing school, the physical therapist, the occupational therapist, anything and everything, including pharmacy, that is got anything to do with medicine. We are going to develop all these allied medical schools to create an environment which it is going to be the center of medical knowledge. So that knowledge is going to be provided through the teaching schools. That way, the next generation is ready for it. And it is going to be a cutting edge technology that we are talking about here. And we are also trying to partner with some of the top universities in US to implement these policies, procedures, and the knowledge base that is needed. One of them right now I'm talking to is Washington University, based out of St. Louis. They are ranked in the top 5 in the country in some of the aspects of these things, and that's essentially what we are looking for. Bring in the top universities in US, partner with them, and implement those things that are needed specifically to Africa.
Excellent, excellent. So a few more questions for you, and I think any one who's watching and saying, okay, how will this come to be? What risks do we face if the diaspora delays engaging with this initiative?
The risks, can you repeat the question? Sorry, I didn't quite get it.
Absolutely, absolutely. So there are many physicians in the diaspora trying to figure out what next is this, how can we partner? Should we even partner? The question is, what risks do we face if physicians in the diaspora delay in engaging with an initiative like this?
So, my suggestion is every physician should be engaged in this project. If it is not this project, some other project to be giving back to their country, their community. Secondly, why this specific project? A, there is strong leadership. B, this is thought out. C, we have looked into similar projects, particularly in India that I have already studied. A couple of them, one of them is Narayana Hrudayalaya, NH, is the short form in Bangalore. They started out with a single hospital. They created NH City, which is what we are also basing this off of. And it is a huge complex now catering to about 10 to 12 million 10 to 12 million people in Bangalore. That is the magnitude that they are serving right now. I have also spoken to a couple of other physicians who have been successful in creating specific parts of healthcare. For example, one of them has just taken care of lower gastrointestinal disorders. He has created about 50 different facilities all over. So the blueprint is already there, and all we are doing is take it to the next level, merge it with the technology that's available in US, borrow from places that have happened, like in India, and implement it into Nigeria. I think it's a perfect way to do it. And if somebody is going to invest in it, are there going to be risks in any investment? Yes. But given the fact that this is well thought out, I think the risks are minimal and the rewards are much higher. Rewards are going to be twofold. One is monetary, and the second one is the satisfaction of doing it for your own people.
For humanity. That's a blessing. All right, two more questions. If you could speak directly to to diaspora associations or physicians listening today, physicians scattered, all over from Nigeria, from Africa, what would you tell them?
I'm going to tell them one simple thing. What I saw when I went back to India. I came to US in 97 and I went back for my class reunion. Looking at what my classmates have been able to do and achieve there. For example, in 95 when I graduated, if I order a CBC or any blood work, next day I used to get those reports in our teaching hospital. We had 2 ventilators in our entire teaching hospital for the ICU. Today, that has exploded into some of the top-notch facilities in the world. And in fact, one of my friends who graduated from Harvard-affiliated cardiologist center went back to India, and in his own words, he said, the physicians in India are better than my Harvard training. He is now back in Arizona, and that is the level to which they have taken it in India. And they are all making money, there is no question. But the biggest sense is they have been able to create, where there was severe healthcare shortage, some of the world-class facilities. And that's essentially what I want to replicate in Nigeria. Why Nigeria? You happen to be my student. And we just discussed.
Oh, that's a blessing. All right. One last question. From your perspective, what is the biggest, or what are the biggest barriers to making a project like Rapha Haven succeed? And how would we overcome them?
Sure. The biggest problem with any project of this size, magnitude, is the sheer willpower to do it. People look at it, it's a huge mountain to climb, they back off. It's not for me. But what we are doing here is assemble the right team, get the right data, Once we have those two things, the rest of those things will all fall in place. So our goal is to gather all the data points, get the finances ready, and then start investing. Is it going to be $100 million project in US dollar terms? $200 million project? Yes, absolutely. Depending on how big we want to dream, it is going to be that big. But at the end of it, looking at the way the projects have worked out in India, looking at what my own classmates have done in India, I think this is easily achievable and it will be done without any question. I have the experience and I am also borrowing the expertise from not only my classmates in India, but also the top hospitals such as Washington University in US, and this will be done without any question.
Dr. Reddy, it has been such a joy. Always great to hear from you, to learn from you. We're very thankful and just looking forward to making this happen in Nigeria. Thank you for your time today.
Sure. Thank you.
Thank you. All right, guys, that's it. That's all it is for today. It was so good having Dr. Reddy here. If you have any questions, by all means, send them our way on Facebook Live, on Facebook, Instagram, on LinkedIn, and we'll be more than happy to address them. For physicians in the diaspora, this is for you. This is your turn to give back. You've been given so much. Let's make it happen. Thank you all, and you have an outstanding day. See you again soon.